Clinical case: fracture of the zygomatic. Luis Eduardo Mercado Piña, Luis Enrique Mercado Piña, teacher Ana Gabriela Ramos Martínez. Introduction to the clinical case. 41-year male with no relevant history, who comes to the emergency room by having, after accidental fall from his own height, a left-right face trauma without loss of consciousness or amnesia of the event. He reports blurred vision and diplopia in his right eye as of the trauma. Examination to the patient. The patient is alert and oriented in time, place, and person when medical examination is performed. He maintained a Glasgow 15 at all times, and the rest of the neurological examination is normal, except for hypoesthesia in the right palatal zone. Other data. A facial inspection shows a bony step off in right zygomatic arch with tenderness and right ale hematoma. When exploring the mouth cavity, there is evidence of a two-fingerbreadth thymus with no other relevant findings. Intervention to the patient. Patient received local cold in the area and intravenous painkillers, and one taken to the hospital for further testing in suspicion of a face fracture. Once he was at the hospital, X-ray showed two fracture traces in right zygomatic arch. No further fractures could be ruled out, and an air-filled reveal in ipsilateral maxillary sinus, with altered morphology, which suggested a fracture of the side wall, with homogeneous associate, and lastly, diastasis of the right frontozygomatic suture. Observations. In the view of their findings in X-ray, a cut was performed to the facial bones, were fracture on the side wall of the maxillary sinus with fracture collapse of the right zygomatic arch, and fracture of the outer wall of the right orbit were seen. Diagnosis. Given these findings, the collaboration of ophthalmology, which ruled out an eye disease at the moment, and maxillofacial surgery, which advised the admission for surgery, was requested. During the admission, the patient was given intravenous antibiotic and anti-inflammatory drugs. After 4 days, he underwent an operation for fracture reduction in the zygomatic arch using the Kintabin, without complications, so that the patient was discharged the next day.